I am Sebrina Barrett, CEO of LeadingAge New York, a position I began on January 21 when the executive budget was released. With a paltry 1.3% funding increase and no restoration of the cap cut, the budget does not address the urgent needs of older adults and people who need long-term care services. We need more permanent funding. Claiming that your family is my fight, the governor's budget doesn't do enough for a key component of most of New York's families, our grandfathers, grandmothers, great-aunts, and uncles, as well as the New Yorkers who care for our older adults, either as family members or paid long-term caregivers. Year after year, we tell you that we will lose services due to inadequate funding, and that is happening now. In 2024, United Helpers closed its assisted living program, leaving St. Lawrence County with no assisted living services. In the Oswego-Syracuse region, St. Luke and Community Wellness Partners had 4 nursing homes with 800 beds. Now they have 3 with about 400. In Rochester, the inability to discharge people from hospitals due to lack of services has resulted in overcrowding of hospitals. The same dynamic has resulted in backups in ERs in the Capital District, resulting in long ER wait times and first responders waiting hours in parking lots. I experienced this firsthand on Friday when my 75-year-old father waited 17 hours for a hospital bed. Reimbursement for long-term care has been so low for so long that more and more of our members are closing their doors. Make sure there's no misunderstanding. We have lost 3,500 nursing home beds since 2014. More than 7,200 beds are offline due to staffing shortages. If things continue, more than 72,000 beds run by financially distressed providers could close. Added together, that is nearly 83,000 beds. The closures would fill Madison Square Garden 4 times. Where are your constituents going to go? Many will relocate hours away from their loved ones. Nursing home residents will lose their home and their caregivers. What about the economic impact to your communities and the families who will have to care for loved ones? Any new funding has been diluted by the capital cut and other takebacks. The governor's proposal adds only $1.3 new, and the 15% cap cut must be restored so providers can offer home-like facilities and honor their debt commitments made before the state broke its promise and eliminated those funds. They have to pay the debt. With capital funds cut, the money has to come from somewhere. Unless it is addressed, this is going to get worse. Between 2015 and 2040, the number of adults over 85 will double in New York, while the number of working-age people to help them is shrinking. We can't compete for this already stretched-thin workforce. Investments in a system trying to survive on rates last set in 2007 are needed today. We do appreciate the governor's proposal that would allow medication aids in nursing homes. Finally, for long-term care in New York to work, all parts of the system must be supported. We need funding increases in the assisted living program, adult day health care Medicaid rate, and home care. We need to expand the assisted living program this year. It is the only Medicaid-assisted option living in the state. And we can save $4.5 million in Medicaid annually by creating a new resident assistant to help older adults. Thank you.
Thank you, Mr. Chairman. This question is going to be for LeadingAge. I asked the commissioner when he was up on the hot seat about the cuts to the capital funding for nursing homes. Could you share a little bit about what kind of capital projects or enhancements to resident care would this capital funding usually support?
Capital funding would usually support projects that would make nursing homes safer, that would make them more home-like for the residents. And the reality is a lot of our LeadingAge members made these type of improvements relying on that capital funding. And now they're stuck with that debt that they can't pay because we've had a 15% capital cut. That can be restored for about $41 million. The other thing that's a hardship is they rely on it to fund those projects going forward. So if they don't have the security and the backing of the state with respect to that funding, they're not going to be able to make those kind of improvements that make nursing homes safer, more home-like. We have a lot of nursing homes that are older and they need improvements. Good ventilation, things like that. So it's really important, it's crucial that those funds be restored. And because they were cut, it really diluted the modest increases that happened last year, the $285 million, which was a one-time addition in funding. That $285 million is in the proposed budget with just an addition of $50 million in state share. And it really means little, less than 1% to our members if that capital cut continues to be in place.
So when you talk about facilities that may have spent the money for capital projects with the assumption that there was going to be reimbursed on the back end, or we're talking about, reliance on agency or traveling nurses combined with losses from having to take units offline due to short staffing, are these all indicative about why we're seeing an increase in closure numbers of facilities across the state?
Yeah, so the closures, there's two things that are happening. One, beds are offline because nonprofit nursing homes are not able to staff. They don't have the funding to recruit and retain staff. And so they're mindful of their mission. They want to provide the best care possible. And they're not going to put folks in beds if they can't properly care for those folks because of staffing. So that's part of it. And the second is, we're looking at real shortages in funding that's going to cause these closures. I heard our members, we had our lobby day last week, and I've heard them talking about going from 900 beds to 400 beds, and maybe by the end of the year, 100 beds. And, the reality of that is people are going to have to drive hours to see their loved ones.
Thank you.
Thank you. Senator Wright.
Good afternoon. Thank you, Chairman, and thank you to our panel. I guess to that same question, I think it's sort of my colleague, obviously this is a real concern, real concern with the access or inaccess to those beds. I just want to look forward a little bit. I guess the question is, because I just want to make sure that I understand, I think I know the question. What is the single biggest contributor to those beds coming offline?
Funding. We haven't received, our rates haven't been rebased since 2007. We are facing rising costs like everywhere else. I've got members that have union contracts that have had 18% increases for wages. That'll another 5%. As part of that 18% is coming this year. Upstate, similar problem. Folks can go and work retail or restaurants for more money, and so those jobs are just not being filled. So that's a huge part of it. You got to have staff in order to provide care.
Right. And obviously as wage costs and costs go up, but what is, in your estimation, would be the ballpark for the funding gap? Cents on the dollar.
Yeah, well, we need a 1.6 billion. When you don't fund things properly for year after year after year, it's going to grow. The funding gap is going to grow. And basically this gap is just the difference between what things actually cost and what they're being reimbursed. And so, I think it's, 400 and some odd million state share. We're asking for a 20% increase. We understand that's a heavy lift, but this is the need that we have. It's not going away.
Last question. It's a question you you won't be able to answer because it's kind of a hypothetical. I said, but if this trend continues and the funding continues to be a funding gap, and whereas you continue to see costs rise, do you anticipate how many more beds would come offline, or I guess it's a hypothetical question. I only have 30 seconds, but
no,
I'd love to hear it.
Yeah, in our written materials, you can see a map that shows the nursing homes that are financially in distress, or with the percentage of where those are at spread throughout the state. And we estimate a total of about 83,000 beds. And like I said, that would fill Madison Square Garden 4 times. And I'm not sure where those folks are going to go. And it's hurting the hospitals too, because if they can't discharge folks to nursing homes, they're taking up hospital beds.
I'll just say with 2 seconds left here, that no room at the end is not an answer.
Right.
Thank you. Slater.
Thank you very much. I think my question is geared towards LeadingAge, but anyone can answer. A lot's changed since 1992, but it's still used as the base year for your Medicaid-funded assisted living programs, I believe, correct?
Yes.
And so can you talk to me a little bit about how many of your of the assisted living programs have closed in the last 5 years and the impact that 1992 number has had?
I don't have those numbers right in front of me, but I can get those for you. But there have been closures.
There have been closures.
Yeah.
And so when you're looking at that 1992 number as your base, can you speak more about what you think would be needed from the legislature? Because that is statutorily, that's in statute, right, the 1992 number?
I know it's 1992. I don't know if it's in statute, but I can get back to you on that as well. But I'm sort of trying to do the math in my head, and 25 plus 8, so that's 33 years. I'm not sure we can do anything today what we were paying for it in 1992.
I was 6, so I totally get it.
That makes me feel really old. So we, just like with nursing homes that are 2007 with the assisted living, we need increases to the base rate from 1992.
Understood. And when providers need rebasing and additional rate increases to remain sustainable, so what overall are the ALP finances like?
Yeah, I will get back to you on the ALP financing.
Okay, great. Well, I can see the rest of my time.
Thank you. My question is also for LeadingAge. Earlier today, Commissioner McDonald answered a question of mine regarding the 1115 waiver money and whether any of that could be allocated to our senior services, particularly as it pertains to prevention and social determinants of care that could help keep people out of nursing homes. Right now, there's absolutely nothing written down suggesting that any of this funding is going to be going to our older New York residents. Could you speak a little bit about the way that funding could be used to help support our nursing home issues and our long-term care problems overall?
So I do think it would be important for funding from the 1115 waiver, if possible, to be allocated for long-term care services, including nursing homes. I don't have the specifics on how that could take place, but we need funding in all areas of the continuum of long-term care. So again, I point you to our written materials, and we can also get back to you on that.
Thank you. And could you speak a little bit about rebasing and the ways in which our not-for-profit nursing homes are disadvantaged by the way we currently rebase our rates?
So, they haven't been rebased since 2007. And so if you look at the rates that nursing homes are currently receiving, they are losing, anywhere from, I've heard an average of $90-some per day per resident, some more than that, some 150, right? And so, we need higher rates, permanent dollars, in order to close the gap, so that, these are the actual costs that our members that LeadingAge members, nonprofit nursing homes are spending, and the reimbursements they're receiving is not sustainable in order for them to continue to provide those services.
And rebasing does occur when nursing homes change hands, correct?
I'm not sure about that. I started my job on January 21st.
Cool
3
beans.
weeks. So I have been drinking from a fire hose. So I appreciate all of these very nuanced questions, and we will absolutely get back to you on that.
All right, so let's say it was true that nursing homes that change hands get to rebase, so that our for-profit nursing homes that frequently change are benefiting from a rebasing rate, but our not-for-profit nursing homes, many of which are sometimes 100 years old, I have one that just celebrated 150 years in my district, are not benefiting from that because of their stability. That is a thing that I hope that we could change. I will cede the rest of my time. Thank you.